so that others can view it later. So this morning, our presenters are going to be Mike Chappell, who's the director of the Northeast and Caribbean Addiction Technology Transfer Center. We also have Ibis Carrion Gonzalez, who's the co-director of that center and located in Puerto Rico. Myself, Ann Murphy, I'm the co-director for the Mental Health Technology Transfer Center. And Kristen Powell, who's the director for the Prevention Technology Transfer. Each of us today will be giving you an introduction of the specific activities of our centers, and we'll also be interested to hear from you a little bit more about what you think we can do to support you. We're going to begin today with a brief poll. So we'll be doing some polling questions throughout the webinar just to have the opportunity to engage with you a bit. So in addition to the polls, I just want to orient everyone that you can also type into the chat box. You're welcome to ask questions there. There's also a Q&A button if you would prefer to ask your question there. And at the end, we'll have the opportunity to respond to your comments and questions. So the first poll here, if you wouldn't mind, you should see up on your screen now a question about who's with us. So if you can just click on the button to indicate what area your work focuses on, either addictions, mental health, prevention, primary care, or another field. And I'm just going to wait a moment here so that you all can indicate your responses. Great, excellent. Okay, I think we got almost everybody, so we're going to go ahead and end the poll. And it looks like we have some addictions providers with us, some mental health providers, a couple from prevention, and several from other category. So thank you all for being here. As I mentioned, for today's agenda, we'll be introducing the overall TTC model, what it is, and how it approaches the transfer of knowledge from the evidence-based into practice. Mike will provide an overview of the ATTC. I'll provide an overview of the MHTTC. Kristen will provide an overview of the PTTC. We'll talk a little bit about how you can connect with our services, and like I said, we'll have a question and answer time. Okay, we're going to ask you another question here. And this is just for us to have a better understanding of who's on the webinar. Have you heard about any of the centers previously? So either the ATTC, the MHTTC, the PTTC, all three of them, none of them? Great, so I see that we have some folks who have heard of all of them, some folks who have heard of the ATTC, just a couple who have heard of the MHTTC and the PTTC, and some that haven't heard of us at all. So to those of you who haven't heard of us previously, welcome. We're happy to have you here. And for those who have heard of some of the centers, you'll be learning more about the others, and maybe a little bit more even about the center that you're already somewhat familiar with. Okay, one more poll question before we get into it. And this one is, if you've heard of any of the TTC centers, have you ever utilized any of the services, either attended a webinar or training, or utilized a resource from the website, or participated in one of the online courses, received technical assistance? Okay, interesting. We've got about a 50-50 split here, so that's excellent. So some of you have already been utilizing some of the services and supports, and some of you haven't, so this is great. All right, well, that helps us understand a little bit better who we have. And I will turn it over to Mike right now to allow him to start to give you an overview of the TTC model. Mike?
Thanks, Ann. Can I take down this poll, Ann? Or?
Oh yeah, you're still seeing the poll?
Yeah. Yeah, I'll take it down. All right. Good morning, everyone. Thanks for attending today. Before we kind of get into specifically what services and how each of these individual centers operate, what topical areas we focus on, what are some of the opportunities for you, we wanted to give everybody an overview of the landscape and really how this came about, because there is a lot of similar work that we do. There's also, as you can tell, we have different topical focus areas in terms of special populations. And oftentimes one of the things that people really have trouble figuring out is, if I need something, who do I contact? And so, we'll try to sort of give you that history, give you that evolution, but also, try to highlight some of the differences in how we work together. So first and foremost, the TTC, you see the umbrella there on the slide. This is one large network that's there, the Technology Transfer Center network, under which 3 different centers fall. So you have the Addiction Technology Transfer Center, the Mental Health Technology Transfer Center, and the Prevention Technology Transfer Center. They're under that umbrella because they all operate according to similar principles, similar strategies and missions in terms of workforce development, capacity building overall. The ATTC was the originally funded center since back in 1993, so over 25 years. Has been funded, and then very recently, within the last year or two, SAMHSA expanded the network to include a mental health TTC and a prevention TTC, hence kind of expanding it to this TTC network. And so we often collaborate in our region, across regions, across the country. And as you can imagine, we saw in the poll before, we have addictions professionals, we have people in the mental health discipline, we have prevention professionals, and we have people that are in a lot of other disciplines. But the reality is that we're all sort of working with the same populations in one way or another. Whether we're in criminal justice, whether we're in faith-based organizations, whether we're in primary care, et cetera. So, this sort of division and this network approach is, unfortunate in some ways, but that's how the funding emerged. But, really, we do have a unified vision that speaks to capacity building, and we'll talk about that in a little bit. So this is the real basic overview. We go to the next slide, Ann. So what are the purpose of the technology transfer centers in general? Again, this stretches across the whole network in all 3 centers. We're really talking about developing the capacities of the specialized behavioral health care as well as primary health care workforce. And so we're talking about substance use disorder and mental health prevention, treatment, and recovery support services. And again, that encompasses the sort of mission of all 3 centers. And in some ways, each of us individually and then collaboratively touch on each. So really what we're looking for here is kind of a no wrong door approach, in terms of integrated technical assistance, if you will. And we're also here really to help people and organizations in particular incorporate effective practices. And that's sort of like a more general term than evidence-based practices. But really in each of these buckets, what are the most effective practices for addiction treatment, recovery support services, mental health treatment, prevention, and all that sort of stuff. So it has a little bit of a different definition depending on which realm or which discipline you're talking about. But again, it's about best practices in those arenas. Next, please. So each of the TTC network, so the ATTC, MHTC, PTTC, includes 13 centers. And so those centers are outlined on your left-hand side with the bullets. So we'll start with the simple. There's 10 regional centers. So if anyone's familiar with the HHS regions, there are 10 centers that cover all 50 states and U.S. territories in the Caribbean and the Pacific Islands. So no matter where you are in the United States, the mainland or otherwise, you have a regional ATTC, MHTTC, and PTTC. So I noticed when we looked at our registrants list, there are some individuals that are registered for this webinar that are from outside region 2. So the particular presentation today will focus on what we do in Region 2. And the people here, the directors here, represent Region 2. But there will be a lot of similarities in terms of what these centers are doing in your region. Some regions, some centers have different specialties, but generally we really are sort of generalists in terms of what we do rather than highly specialized TA providers. So we can do a lot of different things. And then each, in addition to the regional centers, each region, well, there's a National Hispanic and Latino Center and a National American Indian and Alaskan Native Center. So these are specialized nationally, working with the regions to provide culturally and linguistically appropriate services for these two populations. And then each of the networks, the ATTC, the MHTTC, and the PTC, have a network coordinating office. And their role is to sort of work across each of those respective centers or networks. You know, the ATTC Network Coordinating Center heads to promote the ATTC mission, promote collaboration. We do network-wide work groups to produce products and things like that. In addition to all that, the ATTC actually also includes international HIV centers. So their mission is more focused on HIV and the intersection with substance use. But those are funded by PEPFAR. But we do, as the domestic centers, we do interface with, you know, with those international HIV centers. Go ahead, Ann. So this is a map for you. I'm not going to go through all of it, but you see all the numbers in the middle of the map. Those are the HHS regions. For each of those regions, you see the 3 boxes, which will tell you where the ATTC, MHTTC, and PTTC are located. These are all individual grants funded to individual entities. So in some instances, one entity might hold multiple centers, but in most instances, that's not the case. You see Region 2 on the right there, and those are Northeast and Caribbean. ATTC is with me at Columbia University. The MHTTC is at Rutgers University, as is the PTTC. So those are within Region 2. But if you're from another region, you can look at this map and you can kind of figure out, you know, where your respective centers exist. Go ahead, Ann. And so what is SAMHSA's vision for the entire TTC? Remember, these individually funded centers, ATTCs, MHTTs, and PTTCs, have really been funded under a unified vision, although we have different topical and population focus at some points. The idea is that, you know, we want to implement a similar model of training and technical assistance provision. And so we do a lot of network-wide coordination within our own centers and across ATTCs, PTTCs, and MHTTCs. We have nationwide activities. So yes, we do things for our own region, but we also do things nationally so that other regions are able to benefit from what each region is doing. It's sort of the collective impact that we can have. We are a major platform for training access. So all of these centers provide a wide variety of training, and as well as technical assistance. So if you're an organization sitting here and you have particular training needs in certain evidence-based practices, cultural sensitivity, you know, whatever it might be, it's worth speaking to some of your representatives here. And then we also do work nationally and internationally to, you know, sort of inform all of our models. So the national population-specific centers, those, if you remember when we had all the different funded centers up, those are for Hispanic and Latino populations. There's one each for the mental health, prevention, and addictions, and one for the Native American, you know, center for Alaskan natives. They serve as subject matter experts for those specific populations nationally. So those are not regionally based. And the idea is that they provide support for the regional TTCs on issues related to those specific populations. So they sort of work with and through the regions. When we have, you know, initiatives that touch those populations, we can rely on their expertise and bring in their expertise and their resources to make sure that the interventions that we're implementing on the ground within our region are culturally responsive and appropriate. So it's an added resource that is population focused. And then the regional centers, you know, are really responsible to develop and implement a regional approach for workforce development. So every region can be potentially different, as you can imagine. You know, there may be regions that have larger metropolitan centers, that have larger concentrations of certain populations, that have specific issues around substance use. I mean, we all know that, you know, the opioid problem that exists in this country exists differentially depending on where you are. Methamphetamine use is on the rise. It exists differentially depending on where you are. So there are region-specific realities in terms of, you know, proportion urban and rural, and those sorts of things, and you know, certainly what special populations, whether there's tribal nations and where they exist. So the regional centers are responsible for implementing a regional approach, and that's done through kind of ongoing needs assessment, which we'll talk about a little bit. We also coordinate with the National Coordinating Office for nationwide activities. So what are these specific centers, whether they be the ATTCs, the MHTTCs, the PTTCs, doing with their colleagues in other regions to support nationwide activities around specific topic areas. And then again, we coordinate with the national TTCs to support specific populations, as I mentioned, with those populations. And then we also collaborate with our SAMHSA regional administrator. If anyone's not aware, each of the regions has a SAMHSA representative is the lead on that regional activities, as well as an assistant regional administrator. And their responsibility really is to interface with stakeholders and providers, as well as having this portfolio of funded projects on SAMHSA's side that could potentially bring technical assistance. So SAMHSA's regional administrators are often out in the field, they're talking to people, and they know exactly what's going on in the region, they know what the needs are, and they liaise between, you know, community providers and stakeholders and the TA providers like ourselves to try to connect those dots and get those services. So we're often talking to the regional administrator about what's going on, what's happening, who needs what, and then connecting to those individuals in the community.
Okay, so we have just a brief poll here before we move into Mike's description of the specifics around the Addiction Technology Transfer Center. And so we wanted to ask you, Mike's been introducing the overall focus and mission of the TTC network, and some of that is related to providing training and technical assistance. And we were curious from the attendees here, what is your favorite training format? So if you have the opportunity to learn in a variety of formats, what do you like most? Do you like live webinars like this? Do you like in-person workshops, a little more hands-on? Or do you prefer online self-paced courses where you can start the course and come back to it when you have time and sort of complete it at your own pace? So I see your responses are coming in here. I'm going to give it just another couple seconds. Okay, so it looks like in-person workshops are in the lead there. It's about 57%, followed by live webinars, and then trailing behind is the online self-paced course. Okay, so this is helpful for us to know as we plan our activities. This is part of the purpose in us coming to you and introducing ourselves to you, is that we really want to have a reciprocal relationship in which we can get input from you about how you would like things to be delivered, and you can share with us as well about the needs that you see. So we'll talk more about that as we go, but at this point, I'm going to go back to Mike so that he can tell everyone about the Region 2 Addiction Technology Transfer Center.
Thanks, Ann. So at this point, I'm going to speak on behalf of the ATTC, which is my responsibility. And so, you know, just give credit where credit is due. The ATTC is funded and the grant is awarded to Columbia University's Urban Medical Center Division on Substance Use Disorders in the Department of Psychiatry at the Research Foundation for Mental Hygiene at New York State Psychiatric Institute. So that's a a mouthful. We're at NISP at Columbia University, basically. I'm the project director, and while our region covers New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands, you know, our primary responsibility is for activities in New York and New Jersey. You know, obviously that geographical spread, number one, is quite large, right? Puerto Rico and the USVI are not particularly close to New York and New Jersey, although certainly we're on the East Coast, so to speak. But that really happened in the realignment of several years ago of the regions, where the Caribbean, the ATTC actually was its own entity in what they called in the Caribbean Basin with Puerto Rico and the Virgin Islands. And when they realigned, sort of New York and New Jersey got cut off from Pennsylvania and some of the other Northeast states. And so they sort of just put them together, but there's certainly some logic in that, you know, we do have a large Hispanic population, especially Puerto Rican population in New York. And, you know, so that's how, you know, but we do largely, even though I'm the project director, we do kind of geographically split our responsibilities. So we partner with the Institute of Research, Education, and Services, which is IRESA, at the Universidad Central del Caribe, UCC at the School of Medicine located in Bayamón, Puerto Rico. So there we have Ibis Carrion Gonzalez, who is the co-director, and their primary responsibility is for training and TA activities in Puerto Rico and USVI. So it's not that we don't collaborate, it's not that we don't talk often, it's not that we don't have a unified vision for Region 2, but it's that we have very geographically and culturally distinct portions of the region. And so, you know, if you're on the phone and you are, you know, you are in Puerto Rico with USVI, you know, you would contact your folks down there, but you could always get to me and I could get to you down there. But that's an important distinction. And also it's worth mentioning that Ibis and her group were, you know, we're the incumbents and we're running this ATTC in the Caribbean Basin since its inception. So that they not, you know, they have a lot of experience in the region. They know the realities down there. They know the providers. They know the resources, and they have a very, you know, well-oiled machine running training and technical assistance down there. Next, please. Got it. So what is our mission? I mean, these missions are fairly similar across centers and networks. But we're here to accelerate the adoption and implementation of evidence-based and promising addiction treatment and recovery-oriented practices and services. I mean, we know that there's been a lot of research done. There's been a lot of evidence-based established for certain types of interventions like motivational interviewing, cognitive behavioral therapy, contingency management, and others. And there's other best and promising practices that maybe don't reach the level of evidence-based, but that are certainly practice-based evidence in terms of what's being implemented. And we're here to help, you know, accelerate the decision to adopt and then help with the challenges of actually implementing. We're also here to heighten the awareness, knowledge, and skills of the workforce. So, you know, sometimes it's not about, you know, skills-based development or, you know, the implementation with fidelity of an evidence-based practice. Somewhere it's about building awareness, for example, of medication-assisted treatment. You know, we know that there's a lot of evidence to suggest how effective buprenorphine, methadone, Vivitrol, and other, you know, as we kind of continue to evolve these FDA-approved products, we know that there's a lot of evidence about how effective they are, but there's actually limited use of them in practice, right? So sometimes it's about implementation of it. Sometimes it's about building awareness of it. Sometimes it's about changing attitudes. Sometimes there's preconceived notions about what it means, you know, to incorporate medications for opioid use disorder. So we do a range of different things. We do cultural trainings. And then we're here to foster regional and national alliances among practitioners, research, policymakers, funders, and the recovery community. So, you know, we're all in this together. We're all trying to move in the same direction. How can we build those collaborations to help, you know, really promote that collective movement forward? So, what is our target population? This sort of gets back to kind of now you have all these different centers with these topical focus areas such as addiction, mental health, prevention. And then who is it that we're kind of, who's our audience? Who are we looking to deliver training and technical assistance? Whose capacity are we looking to increase? Which part of the workforce are we looking to develop? So when the regional ATTCs were established, we would say that we're here to develop and strengthen the workforce that provides addictions treatment and recovery support services. And so we're targeting frontline counselors, clinical supervisors that are employed in addiction settings. That would be the obvious target audience. But we're also targeting professionals employed in an array of other settings. And these are people, primary care and medical professionals, mental health professionals, criminal justice professionals, other personnel in associated support roles, and you see some examples in the parentheses there. In short, it's not limited to frontline counselors and clinical supervisors employed in addiction settings. Again, that would be our obvious target population, but we will provide training and technical assistance to professionals of a variety of disciplines. If they in the course of their regular work, no matter where they're employed, if they come into contact with individuals with substance use disorders, then there's a potential that you would be a fit. We really have a so don't think to yourself if you're on this webinar listening, well, I don't work in an OASIS licensed or a substance use disorder treatment program. I wouldn't be eligible for these types of training or technical assistance services. If you serve people or individuals with substance use disorders and your staff has needs, workforce development needs in addressing those individuals, then you're a fit for these services. Next, please. So what is it that we do in general? This is a really broad brush. So what we talked a little bit before about how we identify what are some of our topical areas. So what we do is an ongoing regional needs assessment, and that comes in a variety of forms, but over years and years of being funded and working in this arena, you build a lot of contacts. Some of them are formal, some of them are informal. So we have advisory groups that consist of stakeholders in the single state authorities, the provider associations, representing the different sectors who we meet with regularly. We get the pulse on, what seems to be most important or what are some of the biggest needs in the region. But then we don't just rely on what they think. We want to hear from providers directly, so we have representatives there. But mostly it's an informal, ongoing conversations that occur with the regional administrators, that occur with individual providers who contact me via email or phone and say, I heard about the ATTC, we have a challenge in our program and we want to talk about how we maybe can get it met. So it's really ongoing. A good portion of my job as the director is constantly having conversations with people about what their needs are. And in doing that, I get to recognize, themes that are emerging across the region. I can tell you, for example, in the last 2 years alone, most of our requests have had to do with motivational interviewing and SBIRT, screening, brief intervention, and referral to treatment. Some of that reflects what are some of the developments in the region, in states specifically, in counties, but I can always identify sort of common emergent themes. We also work the TTC, the ATTC specifically, in work groups that address a variety of issues that are geared towards product development. So it's not just about training in TA because that's resource intensive, but we come up with pamphlets, brochures, fact sheets, training curricular, guidance documents that are disseminable so that people can get easy access to these types of resources without committing to training and technical assistance interventions. And then of course we do a lot of training workshops. Originally the ATTC was funded mostly as a training entity, but we've obviously in the field has come to realize that you can't just provide training workshops if you expect to implement change in if you expect to affect organizational change, you need to provide implementation support in the form of technical assistance. So we also do that, and that comes from brief consultation where we may just be asking specific questions or pointing people to resources that already exist, to more intensive longitudinal implementation support where we're really sort of holding folks' hands as they look to implement a practice, and they're looking to address the challenges as they do it and have that expert input along the way. So that's a real broad brush. What are some of the basics? And this probably, as you're looking at this, this is probably true for the MHTTCs and the PTTCs as well. And Ann and Kristen will probably reiterate that in spots, but I definitely encourage you to think about this is true for most of the centers. Probably what everybody on here wants to hear is, what we provide, whether it be training workshops, products, technical assistance, is 100% free to programs and providers that request it. We are funded by SAMHSA to do this, and we do not pass that cost on to anyone else. There may be some exceptions in other regions, and it depends on the ask and whatnot, but in all the years that I've done this, I've never charged anybody for anything, and I think you can pretty much count on that 99.9% of the time. It's customizable to target audience and topic areas, so we like to talk to people about what they feel their needs are rather than giving you a menu of training options and say, well, what would you like to get trained on? We would really encourage everyone not just to get training or technical assistance for the sake of training or technical assistance, but to think about it in the context of your organization, your goals for capacity building. What do you want to change? What capacities do you want to build across your staff? What organizational change do you want to back it up with? Not just, oh, that sounds interesting, let's do this 3-hour workshop and have no sort of collective plan for moving that work forward, because that generally, doesn't go anywhere. So we really want to think about a customizable approach in the context of organizational change. Training can be generally conducted locally on site. If those who are requesting it can provide training space to us free of charge, usually that's the exchange, right? If we're not going to charge you, we're thinking we'd much rather put our dollars towards the development of products and delivery of services than towards paying for space. But we're very flexible. We have space, most of us, at our own sites, but if you need us to come to you, that can generally be done. Workshops can be of any length, but generally 6 hours is the recommended time frame, at least for us, but it's usually done in 3 or 6. It can be done in longer. We have longer courses, but most providers don't have that kind of time to spare. Continuing education credits generally can be provided for some, but not all professional disciplines. That's going to depend on what center you're working through. So for the ATTC, it's usually, for certified addiction counselors is a given. We usually can give social work credits too, but that's a discussion you'd have to have with each center in terms of what they provide. And then specific workshops are to be delivered is negotiated based on capacity building needs of requesters. So again, that speaks to the customizable aspect of this all. We want to have a conversation with you about what the problems you're looking to address and what resources are potentially, available to you, rather than just, picking a random training for, just for the sake of training. Same thing, technical assistance, a little bit different, but same in many respects, 100% free, customizable, especially with technical assistance. Technical assistance, there's an array of implementation strategies that can get combined depending on the need, the intensity level, and there's so many factors that are involved. So you really needs to be an in-depth discussion. It could be on-site resource permitting, but there's also many virtual ways of delivering it, in terms of using video conferencing, Zoom, platforms such as the one we're using now. Continuing education credits as well. And again, it can be of varying intensity. So it can consist of just brief consultation, as something as little as a half-hour phone call to direct you to a resource, or it could be something more ongoing and intensive and longitudinal to the point of, we have projects that last, well more than 6-9 months or a year, if they're based on, organizational change goals and are of that intensity. And so, we don't like to sort of pigeonhole ourselves by suggesting that we only do certain things. So these are just examples, but just to give you a flavor of what we do. Certainly a big focus of ours on evidence-based practices for substance use disorders. And, there's a list of some of them in those parentheses there. Those are what we often train on. A lot of work on screening, brief intervention, and referral to treatment to help increase the capacity of providers and organizations to identify individuals with substance use disorders. Obviously, it needs to start there at the very least. A lot of work on recovery-oriented systems of care and peer supports. There's a big movement in New York State, for example, on certified recovery peer advocates, recovery coaches, and there's been a lot of need from organizations in thinking about how to integrate those roles. A lot of work on culturally and linguistically appropriate services. So in our case, specialties around LGBT populations, Hispanic and Latino populations in particular. Work around technology-assisted care. How can we use technology to increase access to treatment? That's in terms of screening, telehealth, telemedicine, et cetera. Integrated behavioral health, so mental health and substance use. So obviously there's some cross-cutting overlap there with other centers, and the integration between behavioral health and primary care. Working a lot in primary care to increase capacity to treat substance use disorders. Professional boundaries and ethics is a major topic. Staff wellness is also a major topic. So these are just examples. I mean, it's not just we have a staff of 6 trainers. We have, the ATTC is not our only project. So we've developed hundreds and hundreds of courses. So what I would say is, if you have a need, you contact us, we'll talk about it. If we can't do it, we won't do it. We're not going to fake our way through it. We will either direct you to somebody else, maybe it's Ann, maybe it's Kristen and their centers, or maybe it's somebody else entirely, or we'll say it's just not something that we can do. But, if it's relevant to substance use disorders treatment or individuals with substance use disorders, we can probably do it. So if you want to connect with us, that slide is up for you. You can visit the website where you'll often see both products. That's for our center in particular, our regional center, but you would have access to the ATTC network wide and other regional centers where you can view their products as well. You can join our listserv if you want to receive regular updates in terms of product release, training opportunities that may be available to you, TA projects that are getting launched, et cetera. You can sign up for a range of training workshop by, through the listserv or by contacting me. And if you have any questions or just want to explore further, you can consult with, ATTC staff, and usually I do that, frontline consultation. And I put my email address there because it's the most reliable way to get in touch with me, and we can set up time to talk.
Thank you, Mike, for the overview of the ATTC. We wanted to ask one more poll question here. And so the question is, now that Mike has reviewed what the ATTC is able to offer, do you anticipate accessing their services in the future? And our feelings aren't hurt here. We certainly understand that it may apply more or less to some of you. We're just trying to get a sense from those in the webinar of who or how many of the folks on the webinar would be looking to access services from the ATTC in the future. I'll give you just another little bit here to respond. Okay, excellent. And just for the sake of time, I'm going to go ahead and close out the poll. So it looks like we've got about 50% of folks saying that they strongly agree, and another 27% saying somewhat agree. So looks like Mike might have a good bit of work coming his way. Not that he needs it, he's got plenty to do, but he's always got more time, I'm sure, speaking for him. So thank you. And what we're going to do now is move on to the Mental Health Technology Transfer Center, and I'll be sharing about that. So the Mental Health Technology Transfer Center is located, as Mike mentioned, at Rutgers University. We're in the School of Health Professions, which is part of Rutgers Biomedical and Health Sciences, in the Department of Psychiatric Rehabilitation and Counseling Professions. Our department here works training future professionals and conducting research and training in the field of psychiatric rehabilitation, which really primarily works with people with more severe psychiatric conditions, like schizophrenia, bipolar disorder, major depression, etc., and the professionals who provide services and supports to those individuals. I serve as the project director on this center, and my co-director and also the PI on this grant is Ken Gill, who's also the chair of our department. So the MHTTC network goals are very similar to the network goals of the Addiction Technology Transfer Center, you'll see. So accelerating the adoption and implementation of evidence-based practices, particularly focusing on the utilization of implementation science to inform those approaches. And implementation science is really just an approach that looks at the reality of the use of the practice on the ground. So trying to move away from how things are done in, what you might call the ivory tower or in very highly controlled environments, and moving it towards the implementation of that practice in a real world setting and how to do that effectively. Heightening the awareness, knowledge, and skills of the workforce, building some regional and national alliances so that we can provide culturally and linguistically appropriate services, and to ensure the availability and delivery of these services at no cost to mental health organizations and providers. So our funding just started in 2018, so we're just several months into the second year of this project. And the purpose of our particular center, the focus of our center, is to enhance the capacity of the workforce, particularly to deliver evidence-based and promising practices to individuals with mental illness. And as I mentioned, particularly individuals with more serious mental illnesses. That being said, we do still address the full continuum of services, including prevention, treatment, and recovery supports. And as Mike mentioned with the ATTC, while our primary target population is the behavioral health workforce, it also goes more broadly than that to include other professionals who are engaging with and providing support for individuals with mental health conditions. So that could include police and first responders, primary care providers, or definitely often the frontline individuals engaging with someone with a mental health condition. It can involve individuals working in vocational services and a variety of other professions. So as Mike mentioned, our scope is quite broad, and so if you are in a position or you know of someone or an organization who's in a position where they're providing support and services to individuals with mental health conditions, then they should reach out to us because we can most likely provide some support for them. Something that's somewhat unique about the MHTTC is that we were awarded in our first year and for the second year supplemental funding to focus on school mental health and training and technical assistance to teachers and school staff regarding student mental health. This comes out of the increased evidence of heightened level of mental health concerns among students, and also the higher rate of suicides among younger and younger students, and particularly the concern around school violence. And so we've been working on this area, enhancing the capability of individuals in school environments to provide those supports to students. So this is focused on both the importance, establishing the importance of those mental health supports, enhancing the capacity to identify students who may have mental health concerns and identify them early, and then to train individuals to implement best models of school-based mental health services, and who and how to link with community-based services as needed for young people who require a higher level of support than can be provided within the school. So as is indicated here, we had funding for the 2018 to 2019 year and 2019 to 2020, and it's pending whether that supplemental funding will be renewed in the future. However, even if it is not, teachers and other school staff do fall under the population of individuals that we have the capacity to provide training and technical assistance for under the primary grant as well. So while we may not be able to provide quite as much or with as much intensity, we will still have the capacity to provide ongoing supports to schools. So some of our approaches are similar to what Mike was describing, so I don't want to belabor it too much, but one of the things that we spend a lot of time doing in year one, and we will continue to do this year and in subsequent years, are ongoing needs assessments. So what's of particular importance to us is to try to address the needs of the region as they emerge. And so we spent some time in year one meeting with the state mental health authorities, with provider organizations, with providers themselves, and other individuals, trying to get a sense of what they identify as the workforce development needs and training needs that they have. This will be an ongoing process, as we know that this will continue to change over time, and as we try to engage as many stakeholders as possible, since different people from different positions identify a variety of needs. So that's also something that we're interested in looking to you here on this webinar for. At the end, there'll be an opportunity for you to share any ideas you have about needs that you see, either for yourself or your organization, or that you see in your part of the region. You can also feel free to reach out to any one of us, I'm sure, individually, if you have particular needs that you want to discuss. So part of the way we address these needs are through national and regional webinars like the one we're holding today, in-person workshops and trainings, technical assistance, as Mike identified, and we similarly provide a range of support from briefer consultation to more intensive training and implementation support. We like to use a community of practice, or a sort of learning community approach, in which providers are connected with other providers, and through facilitated learning can both get information from an expert, but also get information from their peers and from other people doing the work, implementing the practice, and identifying ways that are working for them or not working for them, and how that can apply within your own organization. We also are developing online self-paced courses that are available on the website healtheknowledge.org. I know the ATTC has many courses up there. Some MHTTC courses are beginning to show up, since we've only now been funded for a little over a year, and I imagine some prevention courses are there as well. Those courses are available at no cost, and many of them have continuing education credits associated with them. So I would definitely recommend that you go to that site and you check out all the different variety of courses that are available. I'll also note that there are different formats in those courses. So I would suggest checking out more than one course to get a sense of the formats that you like as well. And then lastly, we also do develop products, fact sheets, training curricula, and issue briefs to try to provide some of that information in ways that you can easily access and download and then reference as needed. So our particular center, as I mentioned, focuses on individuals with more serious mental illnesses. The MHTTC regional centers were all asked to identify areas of focus, and those areas of focus are meant to be areas in which they have particular expertise and can provide support to the other regional centers as needed. So our areas of focus are the practices that are identified in that top row. So supported employment and supported education practices, illness management and recovery, assertive community treatment, and permanent supportive housing. These are areas that we have extensive expertise providing training and consultation in, as well as delivery of these services. And so we'll be providing in-person workshops on this. We're developing online courses for this, and we'll also be hosting a series of webinars in the upcoming 6 months or so that cover each of these topics. We're also focused on several foundational skills that we believe underlie and support each of those practices that are critical on their own, but also facilitate the effective implementation of any one of those individual practices. And those include trauma-informed care, motivational interviewing, CBT approaches, and suicide risk assessment and prevention. As Mike mentioned, motivational interviewing is a topic that we've gotten a lot of requests for and appears to be a need across the region. And so we have been providing quite a few trainings on that topic. Some additional topic areas that we can also address, and as Mike mentioned, it's not limited to these, but these are areas that we have quite a set of resources already available on and can easily provide training and consultation around, particularly peer providers and the supervision of peer providers within non-peer organizations, working with primary care providers to enhance their capacity to comfortably work with people with mental health conditions, also working with sexual minorities in the LGBTQ+ community who have mental health concerns. We have an ongoing project and collaboration with both the Hispanic and Latino Focus Center and the New England MHTTC, looking at mental health recovery among Hispanic and Latino communities. So over the next couple of years, we will be conducting a needs assessment and developing products specific to enhancing mental health recovery within that community. And finally, we've been providing a good number of trainings on staff self-care. This is another area from our needs assessment that came up as a particular area of need identified. Within our school mental health supplement, we're providing trainings on a variety of topics, but they include things like youth mental health first aid, which provides a sort of introductory understanding of mental health concerns and how to identify them, what to do if you have a concern about a young person, trauma-informed care and other trauma practices within a school environment. Cultivating resiliency within students has come up as a high need, certainly suicide prevention and some of the other areas that have been identified as areas of concern and need within the school system. We also have the capacity to do some work with parents and families, whether that be through youth mental health first aid or trainings around parenting strategies. We do have a limited capacity to do some work with them. So that's an overview of the MHTTC. Here's some contact information for us. If you're interested in hearing about our future webinars, our in-person workshops, our technical assistance opportunities, quarterly newsletters, and other information about what's going on within the MHTTC network, I would ask you to subscribe to receive our emails. We have our phone number there, our email address, and our website, which is sort of cut off there, but I will send you these slides and I will correct it prior to sending them out to you so that you can see the full website there. But if you go to mhttcnetwork.org, you can find each of the regional centers that way. So with that being said, we're going to do one more quick poll here and have you let us know, which polling question is this? 6. Have you let us know if you anticipate in your role whether you plan to access MHTTC services in the future. Again, this is one of the newer centers. You may not be as familiar with it as you are with the ATTC. So we're very excited to be able to tell you about it and to connect with you so that you can access our services in the future. Okay, wonderful. So it looks like We've got a good number of people who plan on accessing our services, which makes me very happy. So thank you for that. And now, last but certainly not least, we're going to turn to Kristen Powell, who's going to tell us about the Prevention Technology Transfer Center.
Thanks, Anne, and thanks, Mike. Hi, this is Kristen. So last but not least, we're kind of going upstream. I know at the beginning it didn't look like we had too many prevention folks on, but I'm glad to sort of be able to talk about prevention. And, you know, we like to say in prevention, we try to go upstream, kind of trying to promote healthy choices and prevent substance misuse kind of before we need treatment. So the Region 2 Prevention Technology Transfer Center is managed by the Center for Prevention Science at the School of Social Work at Rutgers. And you can kind of see some of our key staff here on the slide. And just kind of a note, besides our team at the Center for Prevention Science at Rutgers, we also have partnerships with Mike, who you heard from with ATTC, also the Education Development Center, and Dr. Corey Morton from the University of New Hampshire. So that's kind of our team. Anne, if you can, next slide. So we're sort of the babies of the TTC network. We just started year 2 in October, so we were the last one funded. And as you've kind of heard from Mike and Anne, our model is very similar, and kind of our mission and goals are similar. But our mission and goals are really to enhance the capacity of the substance misuse prevention workforce. So how can we build the capacity among prevention professionals to deliver evidence-based and promising practices to make positive changes in their communities? And one of the things we really focus on at the Region 2 PTTC is how can we change our environments in ways that encourage healthy behaviors and make it more difficult for youth to make risky choices around substance misuse. And, you know, part of our mission is striving to increase knowledge and skills of our workforce through the delivery of trainings and technical assistance. Next slide. So, kind of as you've heard from the mental health and the addiction TTCs, we do provide a range of different types of trainings and technical assistance. And I know one of the Q&A questions just a little while ago was, suggesting, a combination, and we do try to provide an array of types of activities so that if you prefer online trainings, you can kind of tune in there, and if you prefer self-paced online versus in person, we try to kind of hit all the different ways of trainings and technical assistance. We do a lot of ongoing needs assessment. I think we all kind of talked about it, but we conducted a survey in year 2 across the full region, and we're actually just sending out a Spanish version to our workforce in Puerto Rico just this month. So we did collect a lot of data through surveys. We also are on an ongoing basis meeting with prevention specialists and systems level folks in the prevention field to get a handle on needs. We actually built a coalition in Region 2 to sort of work with professional membership folks to assess the needs. And then we all actually have our own advisory council where we sort of continue to talk about needs in Region 2. Sorry. So we provide in-person and virtual trainings. We also, in year 2, are starting to launch peer learning sessions. Actually, our first one is this week around policy change. And then, just like the other centers, we provide brief or intensive technical assistance sessions, so that's either through a series of meetings, in person or virtual, and we really like to customize the technical assistance to our target audience. So what is your coalition or agency really needing to increase capacity around, and we can help around that. We have started to build toolkits and other products and facilitate coordination meetings. And I also just wanted to mention that the Region 2 PTTC is involved in several national work groups across all of the TTCs. So we have about 6 or 7 work groups that at a national level we're all working together. So we have participated in workforce work groups to produce products around community coalitions and collaboration, data-informed decisions, culturally and linguistically appropriate prevention practices, and also around opioid education and prevention. So those are just some products that we're doing kind of at the national level. And when we kind of think about topics, as my colleagues have said, this is just a sample of some of the things that we have recently covered. We did have to determine an area of focus for SAMHSA. So Region 2 PTTC is really focused on how can coalitions and prevention agencies and professionals change the environment. So helping the prevention workforce deliver environmental strategies to change the environment around us. So really using public health models to conduct data-driven needs assessment processes, prioritizing the needs of a community, and then implementing community-level prevention strategies. So that's really kind of our area of focus. And then some of these other topics kind of overlap or enhance that area of focus. We do attempt to get credentialing renewal credits for everything that we deliver. And so sometimes it's just renewal credits, and we are in the process of also getting initial credits as well. And when thinking about these sample topics, we may deliver a webinar on, say, changing language, issues of stigma, and then we also provide technical assistance around these specific areas as well. So, and then also what we're trying to do in year 2 is sort of have a series of events around a particular topic. So we launched a webinar series on policy change for alcohol, prescription drugs, marijuana, and our next sort of phase around policy change is to do community learning sessions, peer learning sessions around how folks in the prevention field have been able to change policy or are in the process and are facing challenges, and how we can kind of work together to help the prevention field create more policy changes. And then we will offer more individualized TA around policy change. So we're trying to kind of build our topics around those kind of elements of delivery of services. You can change the slide, Anne. I just wanted to mention a very newly launched self-paced course that we just put out there. And when we think about substance misuse prevention, a lot of times we are thinking about our community. We're concerned with a specific place. And so when we're thinking about that community context, it's important to think about where are hotspots or areas that we can focus our prevention efforts. And so we launched the first of a series of 3, the Geospatial Academy of Prevention Professionals. So this is part 1, which is really giving prevention professionals an introduction to using geographic information systems and basic mapping applications, and we're using this course to describe how to use these applications using a free software package. So we know that a lot of times folks in the prevention field want to use GIS, and some of the software is very expensive. So we've really utilized a free software and showing you how to kind of use that software to your potential. And so some of the things that using GIS can help with is if you're trying to conduct a needs assessment, identify hotspots in your community or your county or your state. This map is an example of kind of showing a couple different issues. So this is disease-promoting pharmacy outlets, and then looking at median income quartiles in a specific county in New Jersey. So just an example of how you can kind of look at different things in your community, overlay them using these kinds of applications. Next slide. And finally, just a kind of a plug, we hope that you will certainly check out our website. So when you do go to pttcnetwork.org, you can see the full network, so all 13 PTTCs, the regional and the national. There's a catalog of resources across all of the PTTCs, and then you can go to our specific page to find some of the things we've been doing. And just kind of a note, we will be in early 2020 posting all of our previous webinars. We have been asked to try to be 508 compliant, so we are kind of working on getting our recorded webinars translated so that we have transcriptions as well. But we will be kind of building our specific website in January and February. So you'll find more there. We do have a listserv, so if you want to join our listserv, we send out quarterly newsletters, and then we do send out, around weekly or every other week notices about any upcoming events, any resources that we want to share. We are also on Twitter and Facebook, and we actually share a lot of resources there. So anything that SAMHSA has been publishing or our sister organizations, we publish, we post on social media, and then my contact information is there.
Excellent. Thank you, Kristen. We have our last, our last polling question. Yep. I think you know what it is. So the final question here is, will you be accessing the PTTC services, that one's hard, in the future? As Kristen said, the PTTC is the newest funded center of all the TTCs, and so they are getting their message out and getting their services out to folks. So if you can let us know. Okay, for the sake of time, I'm going to end the poll and share the results. So we've also got some folks interested in the Prevention Technology Transfer Center, so thank you for that. That is, you've now heard a description of each of the TTC centers and of the overall TTC network. We wanted to spend some time here allowing you all to ask some questions. We've had some come in as we've been going through the descriptions, and we're going to address those now. But for those of you who have not yet asked a question, if you have a question or a comment, you can communicate with us using the chat feature, or you can also use the Q&A box, either one, whichever you prefer. And just some questions that we're particularly interested in your responses to. What are your training needs? So topic areas that you would be interested in receiving training or technical assistance to support implementation within your organization. Are there particular topic areas that you have difficulty getting training on, or finding affordable training? If you could indicate those, that would be helpful. And then if there are ways that we can collaborate effectively with you in a way that is helpful, we'd be happy to hear about that too. And anything else, any other thoughts that you have. So I'm going to encourage Mike and Kristen to unmute themselves so that they're available to respond to these questions. But I'm going to start by posing one of the early questions that came in, and that was, how are you working with local existing training and TA centers to enhance rather than duplicate trainings that are already being provided? So I'll throw that question out if anybody wants to take a stab at that.
Sure, this is Kristen. I think one of the big ways that we've been sort of as kind of coupled with our needs assessment process, so really kind of working at the systems level at each state and territory, and we also built a coalition of provider agencies, so people that represent workforces in addiction, mental health, and prevention. And kind of one of the main reasons for the coalition is really to sort of figure out ways that we can collaborate and enhance what's going on. But I know for PTTC, another important piece is kind of working at the state or jurisdiction level to kind of assess needs and understand what's already being provided at a local level and how can we kind of build on that.
Yeah, I think this is a tough one because I think there are a lot of different training centers and a lot of people are funded either by the state or territory or by another federal grant to do training and technical assistance, and there is a good bit of overlap. And so we do our best to try to be in the know about those other resources and work collaboratively with folks so that we can sort of stretch the resources that are available. But sometimes we are doing similar things. And so if you know of overlap that you want to share with us, we can, that's always helpful. There's so much going on. Sometimes we don't know about something else that's currently available. And I know that we've all reached out to other partner organizations and communicated with them to try to identify ways that we can maybe create a sequential events, meaning if another organization is doing more introductory trainings, then maybe we can do more advanced trainings, or we can support implementation and another organization can do the training or something like that. So we're happy to hear more about different centers that you're aware of, but we do try to stay apprised of the different resources that are available throughout the region and try to work with them, and as Kristen mentioned, with the state agencies to try to not duplicate too much. Another question that we got was whether this services of the TTCs are available for for-profit organizations. And to my understanding, unless Kristen or Mike are going to correct me, I believe they are. I've never been made aware that we can't provide services to the for-profit organizations. So, so that's I think a quick answer to that one. Mike, there was a question that I think you can best address, and it was about an online list of online prevention trainings. Does that exist? And are they OASIS approved for credentialing?
Is there a list of online oh, okay, I found it. I'm just looking for it.
Okay.
Just prevention trainings? I don't know. I mean, I don't know if Kristen, if you've come across this in yours. I know that there are certainly trainings that are geared more towards addiction treatment. By online, I don't know if the question is specifically about self-paced online courses or just whether or not there's an online list of OASIS-approved trainings. But we don't deal as much in prevention credentialing. Kristen, do you know?
I do see that question. Just so you know, in terms of the PTTC, our trainings have been approved for renewal credits, and then we are working to get initial credits as well, where when we fit kind of one of the domains that are needed. So we're kind of in process for our own trainings. I'm not sure of an online prevention list, but I can, Maureen, if you want to just reach out to me, I can certainly chat with you offline about trying to find more trainings. I know that that is an issue.
Yeah, and I mean, I'll say the same for the ATTC. I mean, it's not all of our trainings that we give in person, whatever it is credentialed, but it's generally for renewal credits, not for initial credentialing. I mean, that, you know, that KSAC credentialing, that 350 credits that's required up front to get the KSAC, we're not an approved provider for that.
And it does look like Maureen is looking at initial credentialing there.
Yeah.
And that's an area of need. Thank you for that, Maureen.
Yes, thank you. Yeah.
Okay, there was also a question about what mental health work is being done in the Caribbean, so I will take that. So we spent a good bit of the first year trying to sort of assess the needs in the Caribbean and making some trips there to familiarize ourselves with the differences in the workforce and the workforce needs. In this second year, we are planning a few events down there, a few multi-day events, both in Puerto Rico and in the US Virgin Islands, with the intention to provide training to a broad array of providers and community members. So as Mike mentioned, I believe some of the work that we'll be doing is directed at the mental health workforce, and some is directed at other providers who can provide additional support. So we'll be providing some trainings to where we'll be specifically reaching out to the faith-based communities who are interested in receiving additional training for mental health. We'll be reaching out to primary care providers who are interested in additional mental health training, as well as the mental health workforce itself. And we're currently in the process of identifying a couple people located within Puerto Rico who will be able to provide trainings for us down there. So we'll have some folks traveling to provide the trainings, and then we'll also be having some folks providing the trainings who are local and who have an understanding of the culture. But if there are particular mental health topic areas or needs that anyone is familiar with in the Caribbean and would like to see there, please, you can either share it here through the chat or the Q&A, or you can reach out to me directly. We are more than happy to take that input. And another question, although you may have addressed it, Kristen, was about the GIS and whether that was a training topic that you provided or a service or both. So I think you did sort of get to this, but if you could just quickly recap how you're approaching using GIS and what whether that's something you're training others to do or whether you're providing that as a service.
Yeah, so the most recent way we're sort of delivering training, so we created the self-paced online course. It takes probably roughly about 5 hours, and this is really just an introduction to using GIS, and then also how to use this free software. And then once someone completes the self-paced course, we would have our GIS expert, Dr. Morton, be able to provide individual TA sessions around how that person can then sort of put it into practice. So the hope is that someone will take the course, kind of learn the basics and learn the basics of the software, and then meet with Dr. Morton for TA sessions to really figure out how someone can kind of use some data to create some mapping. So it's a little bit of both.
Okay, excellent. I think that was all of the questions I saw. I don't know if anybody saw anything else that I missed, or if anybody additionally has any final questions. As you are thinking through that, I'll mention that, as you well know at this point, our funding comes from SAMHSA, which requires us to evaluate all the activities that we do as part of the grant. And so we will be sending out an email with a very brief survey. I promise you it's super brief. It'll probably take 2 minutes at most, that will allow you to provide us with some feedback about this webinar. That's very helpful for us, both to demonstrate to SAMHSA what we're doing, but more importantly, so that we can modify what we're doing to better meet your needs. So please look for that in an email coming up very soon. Just a couple additional comments before we let you go. The slides that we've been using during the webinar, we will email out to everyone who's participated. We've also been recording this webinar, and the recording will be made available to everyone. Feel free to share the slides or the recording with any of your colleagues. Again, the purpose of this was really to get the information about our centers out there. Again, feel free to reach out to any of us directly for additional conversation. And also for any of you who are joining us from Puerto Rico, we will be having this same webinar conducted, but in Spanish, for your colleagues who are more comfortable learning in Spanish. And so we will be sending out a notification as soon as we have that scheduled and on the calendar, but I would anticipate that will be in the next several weeks. So we'll send out notification of that. And if there are no more questions, I will thank my colleagues, Mike Chappell from the ATTC and Kristen Powell from the PTTC for their time, and thank all of you for joining us here. We appreciate it, and we look forward to ongoing collaboration. Thank you, and
Great.
have a
Thank you,
wonderful
everyone.
day.